Okay. Good evening, good morning, and good afternoon, everybody. Today it is the 308th section of our Zoom platform of Ifph, International Forum for Promoting Homeopathy. We welcome all of you to this platform to hear a valuable talk about diagnosis and homeopathy. Today, our guest is Dr.Savish Kumar, who was the former head of the Department of Practice of Medicine from Trivandrum Homeomedical College. Now he's the guest faculty of Sharada Krishna Homeopathic Medical College, Kulashekaram. So to achieve our goal, one word, one health, win with homeopathy. So we are marching forward to deliver important speech from our masters and professors today. So we deal with the subject diagnosis and homeopathy. So when we talk about Dr. Savish Kumar, he was the former dean and faculty of homeopathy from the Kerala University, and I am also a student of him, and he's a well-known teacher with he's well-known in his punctuality, then fastidiousness, and he was a voracious reader. Even now, still he's a voracious reader and a good teacher. We are eager to hear from you, sir. Today we are starting our Malayalam section after this 1 hour program from 9:30 onwards, and all are welcome to this platform. So now the platform is yours, sir.
Yes, can you hear?
Yes, sir.
Yes. So we'll be starting today's. Okay. A very good evening and good morning to all the participants from various parts of the world. See, I have selected diagnosis and homeopathy as today's topic because just to show the importance of diagnosis in homeopathy. Formerly, the practice of medicine which deals with the diagnosis and treatment was considered to be an accessory subject because so it was thought that it has more of an allopathic orientation. But actually, when we come to practical field, we can see that diagnosing a disease is as important as selecting a medicine also. That means a double diagnosis of the disease and diagnosis of the individual. So both are equally important and they go hand in hand in practicing homeopathy successfully, according to Dr. Hahnemann's view. At the earliest and speedy cure also, because with the diagnosis we can see that the accessory management becomes easy. Because without knowing a condition, if you just select a medicine alone, sometimes it will be difficult because the accessory management should be correct. See, for example, in a case of sinusitis, when we diagnose sinusitis, see the 50% cure is obtained from steam inhalation, just pure steam inhalation. So that should be our method. So just as an example, that comes in every disease. According to the diagnosis, the general management also is varied. And that is most important in the speedy cure. So they should go hand in hand for a speedy recovery in its full sense. So for this diagnosing, this keen study of materia medica is also necessary because to select a correct medicine, a keen study of materia medica from our masters stalwarts in the field. And Repertory is also one of the best books in therapeutics. Repertory is one of the best book of therapeutics also. So we should have a good and a frequent reference to Repertory also, especially in multi-symptom diseases. Repertorization also becomes necessary. And following the principles of organon of medicine, say prescribing should be according to that single medicine, minimum dose, and repetition also should be according to the principles of organon only. Only when necessary, the second prescription should be made. That is according to the only after exhaustion of the effect of the first dose. And placebo can be the best second remedy also, according to Dr. Ken's suggestion. So I just want to recognize or pay tribute to our gurus also in molding us. You know? See, from the beginning, see, our study in Calicut Homeopathic Medical College, Dr. Pragasham was the principal. And we were impressed by his teaching, especially and giving in clinical tips also. So, for example, he stressed on the importance of theridium as a remedy in nervous hyperesthesia, the extreme sensitivity to noise. It's only an example. Similarly, say Dr. K.J. Isaac and Dr. Isaac and Dr. Pragasham were students of Dr. N.M. Chowdhury at Calicut Homeopathic Medical College. And they were, in fact, teaching us many things. And Dr. Isaac was having a strict adherence to the single dose and minimum dose, even discouraging the inimical use of biochemics. Rather than using an inimical biochemic after selecting the correct remedy, say placebo or blank tablets or something can be given. That was one thing which is stressed on. So, for example, another one, he showed us the effect of calcareous carb 30, a single dose of calcareous carb 30 in controlling the pains of cancer in a patient with the incurable, which a patient who needed cancer remedies pain remedies every 3 or 4 hours. This calcareous carb 30 could abate the pain for so many hours. Of course, it was incurable, but in incurable cases also, selected remedy will be the best palliative also. And then coming to our living legends, say Dr. Ismail said his immense contribution to the rare remedies. So, for example, Chaparro amargosa in chronic diarrhea and dysentery, and also Pereira brava in cases of renal colic, patients who are crawling on all the fours. So such remedies, even thiocyanamide in scars, they are all just a few examples to show how the contribution of these teachers were. And say Dr. K.B. Ramesh, he was by his sharply differentiating the acute and chronic remedies according to the cases. And Dr. Abdul Latif, so he was also immensely influencing us in the management of cases and also in research methodology. Dr. Leelavati Amma and Dr. Ravi M. Nair, they were also principals in the college, and they also helped us in molding our career. Another living legend is, as I have to mention, is Dr. Chandrasekharan, S. Chandrasekharan of Trivandrum, who was senior to us and who worked with us in hospitals. And initially, we had a common hospital for college and district. So they were all contributing. He had a good contribution in selection of rare remedies by his unmatched skill in clinical practice. So, for example, he was prescribing hypocenium for pleural effusion and chelidonium in pneumothorax. We'll come to the cases. I'll show the cases also. So after, from our study, our learning from a lifetime, so we can also go to see Ken's, as I told earlier, Ken's repertory, the 3-mark remedies in, say for example, in pneumonia, respiration difficult, heat with. So you can see the importance of those remedies like epismel, kali, carb, phosphorus, tuberculin, etc. And also in diabetes mellitus, see Ken's repertory, about 9 remedies are given for Ken's repertory, and M.L. Taylor's organ remedies and Hindustani remedies, about 5 remedies. So from all these things, a good coverage of diabetes also can be made. And see, it's almost in all cases, for example, eczema, with the dysfunctional uterine bleeding and diabetes. So you can see that in all these remedies, Bovista will be running through as a first rank remedy. So in such cases with eczema, dysfunctional uterine bleeding, and diabetes. See, boys is likely to be a sure remedy. So that is the importance of therapeutics. No? Therapeutics, just by studying therapeutics, will be an easy selection. But any remedy can come in any case. That, of course, we all know that. And also, according to this principle, in diabetes with the renal failure, oleum terribilinum, because that runs as a common remedy in both the rubrics. And diabetes with the carbuncle, tarantulactobens. Like that, so many cases with the allopathic treatments. When I remember a case where even after 3 months, diabetic gangrene was not healing, and after introducing tarantulactobens, it started healing within 2 or 3 weeks. The patient was admitted in a local hospital here. And also another example can be seen in bronchial asthma. See, Dr. Bonville, he has taught us the use of functional and drainage remedies in acute cases, followed by constitutional remedies or miasmatic remedies to prevent recurrence. That's a golden principle in the treatment of bronchial asthma. And also, for example, in Cupramax, a bronchial asthma patient with the cough dominating, Cupramax can be the remedy. And Ipecac 3x or Ipecac in low potencies can be a functional remedy. So Ipecac, that's a golden tip given by Dr. Gibson Miller, the relationship of remedies. So following that, we can see that Ipecac can be complemented by Cupra. Similarly, natromars in bronchial asthma, where sneezing will be dominating. And we can see that in a common pustular condition in children, IED, infective eczematoid dermatitis. So HEPA-sulf will be almost a sure remedy. Because of unhealthy pustular, that is the main indication of selecting HEPA-sulf. And we have seen from practical experience also that in hemorrhoids, 90% coverage will be given by the tip given by Dr. Richard Hughes' principles and practice of homeopathy. So you can see that he has told that acid fluoricum and hamamelis are 2 remedies for varicose veins. And that is applicable to hemorrhoids also, because we should know that hemorrhoids only the varicosity of the inferior rectal veins. And calcarea fluor is a complement to acid fluoricum. So with the acid fluoricum and calcarea fluoricum, 90% coverage can be made in hemorrhoids. And lastly, about some 1 or 2 points about malignancy also. You can see the case presentation also. Calcarea carb, thoja, phosphorus, conium mac, carbo animalis, and serinum. So Dr. Patel's tip in practice, that is serinum. Even in incurable cases, it can be a palliative also. So the knowledge imbibed from our masters and those acquired from our lifetime practice should be handed to the posterity as the flame or torch of homeopathy, as we can say. And this should be the aim of this international platform for promoting homeopathy. So with this view, I think we'll go to the cases and we see how important diagnosis are also in practice. Shall we go on to the slides?
Although, help him to share the slides.
Yes. So we'll go to the slides one by one. So starting with the respiratory system. So I need not go into anatomy and physiology because it is just for teaching purpose. All this will be necessary, and most of these slides are from our teaching career over the last 25 years in college. So many people, all staff in the department and from other departments also helped in, and PG students in compiling and arranging them. That was a gratitude, because instead of carrying X-rays and scans, all this can be compiled into one document file, and it can be used when necessary. And in early diagnosis, before the physical signs appear. So for example, when you suspect pneumonia, so pneumonia can be found and shown as early as 12 to 16 hours of onset of the symptoms. So for example, fever, cough, or breathing difficulty. So physical signs will take more 1 or 2 days, but this can be seen within 12 to 16 hours or 18 hours of onset of the illness. And in tuberculosis also another condition where early diagnosis can be made, because within a week or two, a diagnosis can be made, because physical signs and symptoms in tuberculosis may take weeks or even months for cavity to develop and the bronchial cavernous breathing to develop and all. It will take time. So these are two conditions where, and in the present pandemic also, say early the X-ray examination can show the lung involvement. So when people having intense cough and all, they should be subjected to X-ray examination. And the X-ray examination is not as dangerous as a CT scan, because a CT scan in fact involves the ionizing radiation equivalent to 400 chest X-rays. So that is the danger in CT scan. But absolutely, when it is absolutely necessary, that should be done. So just normal X-ray. So just anatomical areas to be marked from central to periphery. X-ray should be read from center to periphery. So we should not be initially lost in any area of the X-ray. Make it a plan to read from center to periphery, so that nothing will be left out. So the initial part should be the central region, tracheal region, and then going to the hilar region and the lung areas, apical areas. Any tubercular lesions likely to appear in apical areas first. And in pneumonia, equally important is about the lower zones because of gravity and all. So center to periphery, and finally looking at the bony rib cage, the angulation of ribs. So in emphysema and all, you can see the barrel shaped chest due to the horizontal placement of the ribs. So going to the, so you're not going to the common conditions easily, because so many of these conditions are plain X-ray. Even without knowing by localization of pain, we can diagnose the history of cold. The sinus can be easily diagnosed, but when necessary, an X-ray also may be necessary. But CT scan becomes necessary only in very doubtful cases where a malignancy or something like tumor is suspected. Only then it should be going. We should be going to that. So there will be haziness over the affected sinus in a plain X-ray, and see the common medicines like calibachromicum, and this has to be complemented by a deeper remedy to prevent recurrence. See, Silesia is an example. It may be tuberculinum. So according to the indication, a deep remedy will be necessary to prevent recurrence of sinusitis. I have seen 1 or 2 cases where the patient had an antrum wash about 3 or 4 times, and that lady was coming to OP, and with the indicate remedy. So that indicate remedy in her case was pulsatilla, and that was followed by Silesia. So that recurrence tendency could be avoided, sinusitis cases. So antrum wash, for the time being, there will be relief. But again, this problem, the mucous membrane can be affected. It is only, and the secretions can form. So that tendency can be prevented by constitutional medicines. So haziness in plain X-ray, that is the most important guiding point in, and comparing with the normal sinus, we can see the haziness. And see, frontomaxillary scan might be necessary, as I told earlier, in cases where say blood stain discharge and all continuously, and there can be a doubt about a nasopharyngeal tumor. In such cases, that has to be done. This is a frontofacial-maxillary scan. So a close-up of one, and it can show the sphenoid and ethmoid also. See, haziness over the affected sinus can be seen. So the root of nose, sphenoid and ethmoid can be only thus studied. But practically, it is not necessary, but in some cases, we should know that this also might be necessary. Then coming to the another topic, that is the the hilar prominence, primary complex. Fortunately, this condition is not very common now. Formerly, about 25 or 30 years ago, this was common, and such patients were coming to OP. So you can see the hilar lymph node enlargement, hilar prominence, and fibrosis and calcification also. And blood tests will be giving indication also, the ESR, lymphocytosis, and Mantoux test help in diagnosing the disease. So the medicines used in those cases for primary complex were either arsenic iodide in hot patients and tuberculosis in chilly patients. A very good coverage, and many doctors also were bringing their children, so that the full course of anti-tubercular medicine could be avoided in many cases. And with the national programs and all, the tuberculosis, the primary complex is not so much common now as it was earlier. So the post primary pulmonary tuberculosis, or the tuberculosis with the cavity formation, the tuberculosis seen in adults, that is, so these are the common findings, the hazy opacities, usually apical. And the other changes also you can see, because tuberculosis exhibits pleomorphism. All stages will be going on at the same side. So healing, initial involvement with the haziness, then more advanced cases cavity, and healing cases will be showing fibrosis also. So that, in other words, that exhibits pleomorphism. And medicines we have found useful in those cases were either kali iodatum and also stanamet. Some PG students were working on the efficacy of stanamet and iodum also in those cases. And with the WHO program, open case of tuberculosis are not easily available now. So just we'll leave those cases to, because TB sanatorium also there in some cases. But primary complex is most important. So if it is controlled in that state, see the other conditions can be avoided. See progression into the post-tubercular pulmonary tuberculosis. So pneumonia. So the haziness will be seen, and you can see the haziness, homogeneous, dense opacity. And that usually affects the lower lobes because of some gravity also will have a role in that. And see the medicines from Ken's repertory. If you start with the correct remedy from the beginning, see when we give bryonia and all initially for fever, when the breathing difficulty or chest pain starts, we should go to the more advanced bryonia, that is Kalikarb. All features of bryonia, but more advanced with the dyspnea also. So that's one remedy. Epismal, 3-mark remedies given in Ken's repertory for respiration difficult, heat with. And that is applicable to not only for pneumonia, even for asthmatic bronchitis and so many such conditions. Or in other words, as M.L. Taylor describes in her book, The Pointers, it is acute chest. So all acute chest remedies will be covered by these remedies. So epismal, Kalikarb, the advanced bryonia, and it also may require phosphorus, iodum. Dr. Vishwambara describes phosphorus as a head remedy in pneumonia. So it's important there, and tuberculinum also, and iodum. Those remedies can help in controlling acute chest. And nowadays we'll be going to the next condition also. Acute chest will be seen in the present pandemic also. In that condition also, the remedies will be same, because homeopathy, we are not prescribing based on the diagnosis, but according to the going to a child with the pneumonia. See that consolidation is not a homogeneous dense opacity, but homogeneous dense opacity over a lobe or segment. It is not over the entire lobe, but it is confined to a bronchopulmonary segment. So that case, so with the X-ray facility in the hospital, this could be diagnosed as pneumonia. And we started with the medicines like Kalikarb or epismal in that case. And that recovered, see, because in the next film, after a week, the complete disappearance, and patient did not have any difficulty at all. So with these principles of selection of remedy according to the totality of symptoms, these remedies can help in a complete cure. See a bronchopneumonia picture, see patchy opacities bilateral. Whether it is bronchopneumonia or lobar pneumonia, the drugs are the same. So start with epismal, Kalikarb, phosphorus, tuberculin. So that bronchopneumonia cases also will be, but only picture is bilateral involvement of patchy opacities. So next, this is a picture in a COVID case, a moderately involved case. See the chest picture. As described earlier in our discussion, I saw about the hazy opacities, the ground glass opacities and all. This is such a case. See, with the this was a recent one from a hospital in Koilon where my brother is working, and he showed me, sent us these slides. A patient with the moderate involvement, he was in ventilator and all, but he fortunately recovered. See, the both lungs showing the involvement, patchy opacities in both lungs. And I could also learn that this was the classification of CORAD. That's a radiologist terminology for the lung involvement. Depending on the all 5 lobes in the lung, both lungs. All 5, each lobe is marked, given 5 points for maximum involvement. So according to that, 25 will be the maximum CORAD points to be noted. And this one, according to that classification, has about 10 to 15 only, which is a moderate involvement. And in severe cases, it will be more than 20 cases will be almost fatal, will be ending fatally. So this is 10 more, and this patient fortunately recovered. And according to our medication, see, as we discussed earlier, when respiration difficult starts, we can go to these remedies, starting with the, according to modalities, epismal, calicarb. Calicarb is typical of bryonia, but all chest pain and breathing difficulty starting in calicarb, epismal, phosphorus, tuberculum. And see, the pathology in this case, it is not similar to pneumonia. So in pneumonia, there is consolidation. And say the next case with the more advanced cases, it is not consolidation occurring, but it is mostly due to a vascular phenomenon with the clot formation and small amounts of hemorrhage and clot. The exact mechanism is still not understood clearly. See the condition starting with the cytokine storm and all in initial early. When cough starts in, it is said to say cytokine storm is said to be setting in. And that can lead to all these processes. The exact mechanism still properly not understood, but it is mostly due to the vascular involvement, which leads to tubular obstruction. See, the bronchial obstruction occurs in these cases, and that is leading to hypoxemia. So initially that happy hypoxia and all, but see in more advanced cases, see the oxygen concentration will be falling. It is all due to the block in the air vessels, not the infiltration in the, as in pneumonia. So in pneumonia, you know about the changes of the exudation into the term pulmonary capillaries and also into the alveoli. That is not the mechanism in this case, but still all the mechanisms are still not known. But see, this is the picture of an unfortunate patient who had more than 20 corax. So you can see extensive involvement of both lungs and with the heavy patchy involvement. So according to that classification, it may be about 22 or something like that. So that patient did not recover also. A 53-year-old man, he did not recover from this illness. Heavily involved lungs in this case. So we'll be passing on to the next one. So just a pleural effusion case. So in this, see pleural effusion, you can see the homogeneous dense opacity and which rises up laterally and upwards. See, a homogeneous dense opacity rising laterally, that is the nature in pleural effusion, no? Rising upwards and laterally. And blunting of costophonic angle. So costophonic angle can be seen here, but on the other side, even slight effusion will obliterate costophonic angle. So according to the suggestions given by Dr. Chandrasekharan, hypocinium was used in one case. That is a powerful glandular nosode from horses. That is hypocinium. And another one is, see, the chelidonium. See, because pleural effusion can cause pain in the shoulder. So based on that, he suggested chelidonium for diaphragmatic involvement, diaphragmatic pleurisy may present as shoulder pain in that particular site. So chelidonium was such a tip given by him. And Calicarb, of course, is another one which can come in all consolidation. It is also useful in absorbing. This hypocinium can also be useful in tumors also, in tuberculosis and tumors. So if you see hypocinium, that is one of the remedies useful in those cases. So going to the next one, see that is pleural effusion. See the horizontal post-aspiration film shows horizontal fluid levels. So pleural effusion will not be rising upwards and laterally, because after aspiration, the fluid level will become prominent. So in emphysema, see, it's a chronic obstructive pulmonary disease. You can see hypertransfusion lung fields bilaterally and more horizontal drips, tubular cardiac shadow, that is a teardrop appearance of the cardiac shadow. Then the emphysematous bullae, bunch of grape appearance, and low flat diaphragm. All these typical features may not be obtained in a single film. So you can see and see the medicines used, because emphysema will have, COPD will have least movement, breathing difficulty. Say antimonium arsenicum, aspidosperma. So aspidosperma was usually used in those cases, COPD, least movement causing dyspnea. Naphthalene, Pix liquida, lobelia, and balsamum peruvium. All these medicines can be compared in emphysematous cases. See, this is a typical emphysema. See, the hypertransfusion lung fields can be seen bilaterally. That is typical of emphysema. And the more horizontal, exactly horizontal drips, making emphysema the typical barrel-shaped chest. So fortunately, the present day population in India, they have minimized smoking. So many elderly people, see, in our early days of practice, we used to see so many COPD cases in wards. But because of the present generation stopping and giving up smoking, only the incidence is very low. And so the disease also is becoming less. COPD disease cases are becoming less. So coming to bronchiectasis is another case. So plain X-ray may appear normal, but on close examination, small dilated cystic spaces and fibrosis can be seen. So that is bronchiectasis. And it can, plain X-ray is not useful in diagnosis, but see, CT scan thorax can help in diagnosing. So this one appears to be a normal one with the branching tree-like appearance of the trachea and the bronch. See, but you can see in another one. See, this is a typical one where CT scan shows dilated bronchioles. So dilated bronchioles also can be, especially on one side, you can see the normal branching tree-like pattern can be seen. This is the tree in bud appearance of helpful in diagnosing. See, CT scan shows bronchioles, dilated bronchioles, the typical tree in bud appearance. And medicines, see, kali iodatum, offensive secretions, balsamum, phalantrium, especially in post-tubercular cases. That we had our discussion with the Mathematical department, and we selected phalantrium in a very offensive sputum case, and the large amount of sputum subsided within a week after giving phalantrium 30. It was a post-tubercular bronchiectasis case. So the diagnosis and selection of medicine should be going hand in hand. See the industrial lung diseases, that is occupational lung diseases, where there may be miliary mottling, massive pulmonary fibrosis, fluffy cardiac cillet, and medicines like, again, Silesia and Aspidosperma are useful to some, even though it is said that miliary extensive changes in lungs cannot be reversed, but we have seen help from medicines like Silesia and Aspidosperma. See, interstitial lung disease, ILD, that is, the examples are farmer's lung, where there may be cryptogenic fibrosing alveolitis. The X-ray will be showing shrunken lungs, elevated hemidiaphragms. See, shrunken lungs and hemidiaphragms will be elevated. bilaterally, giving a very small lung-like appearance. And pulmonary function tests will be showing a restrictive pattern. That is, both the forced vital capacity and forced expiratory volume in 1 second will be reduced. So the ratio will appear normal when pulmonary function test, but blood gas analysis will show the severe involvement. See, the oxygen reduction and carbon dioxide increase can be shown by the pulmonary function test. Only the spirometry part will appear normal, but blood gas analysis, partial oxygen tension will be different. So interstitial lung diseases on a biopsy, a honeycomb pattern can be obtained. So this is also a very rare case nowadays. See, lung abscess. See, patient after pneumonia, he developed a complication of lung abscess. The pneumonic consolidation can be still seen on the right lower lobe, and above there is a fluid level, and above that there is a cavity, that is the air space. That is a typical appearance of lung abscess. The case was treated in a hospital. The patient brought this, and it was collected only for academic interest. See, pulmonary adenoma, that is a hilar involvement. See, the adenomas will appear as a nodular opacity in the hilar region. X-ray examination, but unlike with small children, this can occur in young adults usually, and also in elderly people also. So that is hilar node enlargement, nodular opacity. That is a picture of pulmonary adenoma. So there were cases treated in hospital. We can show that, see that also. It is a lung cancer, side lateral view and the PA view showing the dense opacities. Because a malignancy can mimic any disease. It can mimic pneumonia. It can mimic tuberculosis, like that. So this is a nodule on the left lung on CT scan. So CT scan may be necessary in studying the details of a nodular opacity which appeared to be malignant. This is an extensive involvement in lungs. See, multiple metastatic deposits, coin-shaped deposit or cannon-shot opacities can be seen in both lungs. This also was treated in hospital, and see, it cannot be cured, but the best palliative, similimum can be the best palliative medicine also. The troublesome cough and could be reduced by carbo animalis or coniamine. That was one of the remedies selected in this case. And of course, with the intercurrent doses of serinum or such remedies. So this originated actually 8 years ago from a malignancy from a tumor in the lacrimal apparatus. 8 years after, he presented with the multiple deposits in the lung, with the cough and breathing difficulty set in. Investigations were done, and this was the history in this case. So going to some of the elementary diseases. So pulmonary adenoma case also, as I told earlier, showed earlier, that also presented with the cough and breathing difficulty, and that man also had tuberculosis. So the X-ray, the hilar region, it was not in the hilar region, but it was in the somewhere in the upper lobe. So that was initially mistaken for tuberculosis by the tuberculosis center, and they gave anti-tubercular treatment, but without response. So again, further scans and all were made in that case, and a fine needle aspiration cytology also was made, and it was confirmed as pulmonary adenoma, and the patient recovered. That case was phosphorus case. His diabetes also improved with the phosphorus, because one of the 3-mark remedies for diabetes also is phosphorus. So the adenoma completely disappeared within next 3 or 4 months. That was the case of a pulmonary adenoma in a male about 59 years. So going to some of the cases, because we'll be going skipping some of them, because this one a barium solo examination. See the dilated esophagus and the sharp tapering the ractile appearance in malignancy. So barium is useful in diagnosing these conditions, but nowadays with the endoscopy and all, even without barium, it can be done. So endoscopy can show the light arrangement at the tip, can show the mass and the involvement. But this was done earlier for diagnosing malignancy, the ractile appearance in this case. Plummer-Vinson syndrome, that another case, we can see that one. So this lady who was an elderly lady, the post-cricoid web, see that was seen in our college X-ray. This was diagnosed, and she was given Calcarea Force 200. Calcarea Force was the remedy. She was anemic. She had difficulty in swallowing, and Calcarea Force helped in controlling and helping making her comfortable. So this barium studies are also useful in diagnosing ulcer crater and such things. So ulcer crater can be controlled. And see the another one with the barium study, that is from barium enema. See, from the lower part it was introduced, and see the ascending colon and the transverse colon and descending colon, they are all showing these features: loss of ostration and the spring sign. Diagnosed with the diagnosis of inflammatory bowel disease. So this also was helped by lycopodium was the selected remedy, and its weight also increased by 12 kilos after within a period of 3 to 4 months. So inflammatory bowel diseases helped by lycopodium, and he was so happy, stayed in Trivandrum for 3 months before returning home. But you cannot say how much these features will be changed, because these are some pathological changes with the spring sign, with fibrosis and all. But anyway, he was come and he had gained 12 kilos under lycopodium. That was the remedy in this case. So this is another investigation used, and that is oral cholecystogram. In this, the gallbladder studied, and say before meals and after meals. After meals, there will be distance of gallbladder, and this was due to the obstruction somewhere near the common bile duct by the gallstones. So this case, with the advent of ultrasounds, sound examination, this one becomes obliterate, becoming out of use, this oral cholecystogram. So I'll show the next one. That is secondaries in liver. See, the patient hypodense opacities in the liver. That is due to secondaries in liver. See another one. This is due to carcinoma. And see the pancreatic involvement, see pancreatic duct obstruction by the small, what appears like the number 40 globules in homeopathy. Those are actually the pancreatic calculi causing obstruction. So case of chronic pancreatic, CCP, chronic calculus pancreatitis. Going to the next one. That is only a pancreatic cyst. The length and breadth of the cyst has been shown here. And this patient with the, so he was given iodine, iodine or phosphorus was the remedy in this case, because he had chronic diarrhea and diabetes. When pancreas is involved, say the exocrine and endocrine function will be affected. And he was showing all those features, and phosphorus helped the chronic diarrhea. So this is secondaries in liver from carcinoma elsewhere. So you can see hypodense areas and the liver filling the whole mass area. So this is also a part of CT scan of showing the adhesions in the peritoneum and the ascites. The patient with the carcinoma pancreas, the secondaries. So nephrocalcinosis, showing deposits in the kidneys. So this one is a typical ultrasound scan, see, showing the presence of gallstones in the gallbladder. And this also leaves, see, the typical gallstones can be seen as opaque bodies, and you can see the shadows also, the acoustic shadows. That is confirmatory of gallstone disease. So the gallstone disease also can be helped with the constitutional remedies. So remember phosphorus, silicea, all helping in patients with this one. So abdominal tumors also can be shown by the ultrasound studies. Normal abdominal X-ray. Normal abdominal X-ray will show the bowel gases also, that is normal. So genitourinary system. So showing the large bladder calculus. Stone of about 3 to 4 centimeters could be seen. And this is another one with the staghorn calculi and the right kidney. So diagnosing them and treating. There is a useful homeopathic treatment according to constitution. Medicines like Toja, Lycopodium, they all help in avoiding a catheter and also in clearing up the stone tendency. Large stones may have to be removed by surgery sometimes. See, the first stone I showed in the bladder was a large one, about 3 to 4 centimeters. So we send the patient for surgery. And after that, we continued the homeopathic treatment to prevent recurrence. That is nephrocalcinosis. Again, so both the kidneys becoming heavily studded with the calcium. That was due to a patient who was taking homeopathic medicine, not initially. The patient who had chronic diarrhea, and doctors prescribed calcium and vitamin D. So the parents were giving that continuously for 1 or 2 years, leading to calcification in the kidneys, nephrocalcinosis. And that had to be later corrected by according to the Mendeleev's periodic table, the salts higher in that can displace this. So calcium could be dissolved by salts of sodium and potassium. So it was given as a solution by the pediatric center in hospital, and this was gradually dissolved. Nephrocalcinosis can occur from over-enthusiastic calcium and vitamin D supplements. This was continued for 2 years for this child to develop nephrocalcinosis. So parents unknowingly gave that for about 1 or 2 years. So another investigations for showing the renal filtration. That is IVP studies. Normal. This one is not affected, but in the left side there is an obstruction. So the site of obstruction, the dyes are filtering only up to that, and from the other side it has come to the bladder, and see these are only investigations, and this will help in studying the function of kidney also, which kidney is functioning properly. Otherwise, plain X-ray and ultrasound can help in diagnosis. But IVP is useful in studying the function also, renal function. So another one showing the right side in normal and the left side the site of obstruction, and the hydronephrosis on the right side, the filtration of dye on the right side. So, the 20 minutes after the same patient, see the dye collecting in the bladder. So all these are investigations for studying the function. The same patient showing the dilated calyces on the left side. So the other side is not affected, dye is going through that. Here it is all these are due to the pathological changes. There is a gross dilated calyces, renal calyces. And see the dye is collecting in that region. So 2 hours after the dye, most of the dye is collected in the bladder. So those are series in IVP. So renal calculi, see, clearly diagnosed by ultrasound studies. So the calculi can be seen as whitish deposits. And this, if you study one film, see a close-up of one film can show the details. So the kidney is shown here, and the calculi are marked there, and you see the acoustic shadow also can be seen. So renal calculi is a field where homeopathy can give much results without surgery. And the tendency, the most important is the tendency to renal calculi can be overcome with the constitutional medicines. All these are investigations to show the renal function. See renogram by nuclear is coming under scintigraphy. Nuclear say, technetium or such dyes are used, and both kidneys can be seen in the same film. And after 25 minutes, it is collecting in the bladder. So fibroid uterus also can be shown by ultrasound studies, and it's very important in fibroid uterus because see the mass can be, the measurement can be made, and it is useful in knowing the prognosis also with the treatment, how much has shrunken. That is another function of the ultrasound study in medicine. You can see know the effect of the treatment. So after 4 months or 6 months, a repeat scan can be made so that the effect of treatment can be shown. And all these should be recorded also, so that before treatment and after treatment, the changes occurring and how much of progress can be made with the medicine. So that is evidence-based medicine. And that should be statistically studied also, so that you can see how many cases are responding to treatment. That is one of the ideas in investigations also. So just mammogram, so a normal one where there may not be any microcalcifications, but you can see a calcification in another one. See. So the mammogram is showing a focus of involvement. So such cases should be investigated. Further investigation, FNAC, and so if necessary, that is the importance of diagnosis. So without, so rather than blindly treating a patient, all investigation should be done. Whatever necessary investigations should be done so that satisfactory treatment can be given. Because when surgery is necessary, that we should not hesitate in sending for surgery also, because some masses should be removed and then treatment should be continued, because to avoid the chance of metastasis, that line of treatment should be followed. So this is another investigation, hysterosalpingogram, just to study the function of the uterus, the patent fallopian tubes. The spilled dye can be seen on both sides. Dye spilling showing the normal function. Hysterosalpingogram. So cardiology, these are the investigations are done to chest X-ray. See, example, a patient with the hypertension, this aortic knuckle, and the cardiomegaly. Cardiomegaly, cardiothoracic ratio more than 50% is cardiomegaly. So I'll be going in a hurry because time constraint is there. So these are all some of the investigations in mitral stenosis, the straightening of the left border. All these are just to understand what the condition is. So here, extensive cardiomegaly, cardiothoracic ratio can be, so just by a straight line across the maximum points within the thoracic cage, you can see it is more than, when the cardiac size is more than 50% of the thoracic cage. So cardiothoracic ratio more than 50%. It's cardiomegaly. So atrial septal defect showing the ventricular hypertrophy. Arch of aorta. That all these are cases of hypertension. See, this one, the typical boot shaping due to extensive involvement of the left ventricle. The aortic knuckle can be seen, and the extensive left ventricle boot shaping can also be seen. So such patients will require particular care because there is more chance of going into myocardial infarction, because when the ventricle is hypertrophied, there can be mismatch between the available blood supply and the demand. That is the cause of myocardial infarction. So that can be avoided. Such cases can be given particular importance. And see, in addition to the indicator anomaly, Crataegus also will be a cardiac tonic in those cases. the globular cardiac shadow. See, a patient with a heavy involvement. See? Because both the left ventricle and right ventricle enlargement leading to globular cardiac shadow. So he had a valvular problem, and she developed, over the years, she developed a right-sided hypertrophy also, leading to globular cardiac shadow, which should be differentiated from a pericardial effusion. Pulmonary hypertension, with the changes of pulmonary hypertension can be seen from X-ray also. So calcified aortic arch and left ventricular hypertrophy, another picture in hypertension. So based on the this investigation, we can decide on whether color Doppler can show the flow of blood, and angiogram can decide on whether medical line of treatment or surgical line of treatment will be necessary. That's very important, no? For us to understand. Based on the angiogram, single vessel disease or multiple vessel disease can be understood, and treatment can be planned accordingly. Medical line of treatment or surgical. So that is the. So we are going to see, this is only osteoarthrosis. So I'll be stopping within 2 or 3 minutes. Heavily involvement in both the legs, osteoarthrosis, which may require knee replacement therapy also in some cases. Yes, I think that is the most important part in scan, and this cervical spondylosis can be clearly understood from an MRI scan. The indentation can be clearly seen. Plain X-ray can show the cervical spondylosis, and confirmation from MRI also. How much damage is caused by the cervical spondylosis. See, Pearl's disease, where extensive involvement of the joint is there. Ankylosing spondylosis, the bamboo spine appearance. They all even collagen disorders can be helped with the constitutional medicine. Even Thuja and such medicines will be used. Radionuclide imaging, neuroradiology. So we are coming to the last part of the section. That is the CT scan brain. See, hemorrhages in the brain. A small hemorrhage is seen here, appearing as hyperdense area. And see, after 1 year, see, the hemorrhage disappeared, but the patient became paralytic or hemiplegic, because the area, this area was dark area, was an infarct because of the hemorrhage. That area did not get the blood supply. So that's about the last part, and we'll be concluding now.
Okay. Thank you. Thank you very much, Savish sir. So today we are today we are cancelling our question and answer session since, because we have to start the next session by 9:30. So I invite Dr. Manoj to deliver the vote of thanks. Dr. Manoj.
Yes. Sorry, it took a little more time than more than expected. Okay.
So no sir, no problem, sir. Okay. Thank you, Dr. Elias. I'm very happy to, we are all happy to be here. Once again, our dearest and honorable Dr. Savish sir. It's a very good and interesting session. On behalf of IFPH, I am expressing my sincere thanks and gratitude to you, sir. Thank you, sir.